Ever thought that the seemingly innocent ginger could be a health hazard? Yes, you heard that right. This fiery root, often hailed as a miracle cure-all, could potentially be a wolf in sheep's clothing. Ginger, while offering a plethora of health benefits, can also pose risks if you're dealing with certain medical conditions. Now, don't get me wrong. Ginger is excellent for digestion, easing nausea, and even combating the common cold. But like all good things, it's not for everyone. For some, it could do more harm than good. Today, we're going to unravel the paradox of ginger. We'll delve into the circumstances where this healthful herb could be your foe rather than your friend. We'll discuss how it interacts with blood disorders, how it could complicate gallstones, and the risks it presents to heart conditions and during pregnancy. So, let's delve into why ginger could be a no-go in these specific medical scenarios. First up on our list, blood disorders. Now, we all know that ginger is a superfood with a plethora of health benefits. But did you know that it could potentially be hazardous for people with blood disorders? Here's the twist. Ginger has properties that can increase the risk of bleeding. Yes, you heard right. This powerful root, while beneficial for many, can cause more harm than good for those with blood disorders. But how does this happen? Well, ginger can interfere with anticoagulant medications. These are drugs that prevent or reduce coagulation of blood, turning it into a free-flowing liquid. When ginger interferes with these medications, it can lead to a higher risk of bleeding. This doesn't mean you should ditch ginger entirely if you have a blood disorder, but it does mean you should be cautious. Therefore, if you have a blood disorder, it's best to consult with your healthcare provider before adding ginger to your diet. Up next, we have gallstones. Picture this: small pebbles nestled in your gallbladder, a small organ tucked beneath your liver. These are gallstones, hard deposits that can range in size from a grain of sand to a golf ball. They're a common condition, but not everyone experiences symptoms. Now let's look at ginger's role in this scenario. Ginger is known for its ability to stimulate digestion, which includes increasing the flow of bile. Bile aids in the digestion of fats, and normally this would be a good thing, but in the case of gallstones, it's a different story. When bile flow is increased, it can potentially force gallstones into the bile duct, causing a blockage. This blockage can lead to severe pain and other serious complications such as inflammation or infection of the gallbladder. So for those with gallstones, ginger might not be your best friend. It's always important to consider your personal health circumstances before incorporating new foods or supplements into your diet. Lastly, we look at heart conditions and pregnancy. Ginger is a culinary gem, offering a plethora of health benefits. However, it's important to understand that it can also lower blood pressure and slow blood clotting, a feature that could be harmful for individuals with certain heart conditions. The anticoagulant nature of ginger might interfere with medications used for treating heart conditions, leading to potential complications. Then let's delve into pregnancy. Ginger, often hailed for its ability to curb morning sickness, may have a flip side too. Some studies suggest that ginger could affect fetal development during pregnancy. High consumption levels might interfere with fetal sex hormones and even lead to miscarriage or preterm birth. While the research is still in progress, the potential risk cannot be ignored. Thus, for heart patients and expecting mothers, caution is advised when it comes to ginger. It's always best to consult with your healthcare provider before adding it to your diet, especially in large amounts. So there you have it. Ginger, while beneficial for many, can have adverse effects in blood disorders, gallstones, heart conditions, and pregnancy. Always consult with your healthcare provider before making diet changes. Remember, when it comes to health, knowledge is power. Stay informed, stay healthy.